This is Dr. Jerry Hesch, a physical therapist from the Hesch Institute in Aurora, Colorado. And my client Leah is a physical therapist who describes some elbow and lateral forearm pain. Can you tell us a little bit about it?
It just hurts through here intermittently. It's worse in the morning after I sleep on it.
Okay. And we took a look at your elbow a while ago, and what we found, and this is pretty subtle, and I just don't know that the camera will see this, but you observe this as well, that when we supinate your forearm, it seems to stop. There's a reduction of proximal movement in the muscle mass here. When we compare that to the other side, you can see movement at that end range. And the other thing is that on the left elbow, the distal aspect of the forearm, just below the wrist, rotates all the way to neutral, whereas on the right, it rotates to about -15. The other thing we found is that there's a shallow sulcus below the styloid, the radius of the radius, that's more shallow in comparison to the left side. And when we try and traction your radius on the right, there's no give. I'm trying to pull downward, and there's just no yield there. Whereas when we do that on the left side, you feel that little bit of give, a little bit of play. Most interesting is when we test your strength, and I hope the camera view captures this, on the count of 3, don't let me supinate your forearm, which means relax. Let me show supination. Yeah, don't let me pull it out that way. Ready? 1, 2, 3, go. So she's plenty strong, and I cannot untwist that forearm. And let's do that on this side now. So at the count of 3, don't let me untwist it. 1, 2, 3, go. So easy to treat, to break that. And the treatment is so easy. I simply capture the radius and I treat it in superior glide. I'm stabilizing proximally at the humerus. I'm capturing the radius and I'm just gliding it superiorly, firmly, about 30 reps.
While it's in supination.
While it's in pronation. Yeah. And I don't know how much that matters, whether it's in supination, neutral, or pronation.
Okay.
I don't know.
Okay.
I just know it's never failed me.
Okay.
All right. So that's probably 30 times. And now let's test that play. You feel that little bit of traction now?
A little bit more, yeah.
Okay. And now let's rotate it outward.
You can see it
And I see movement. I see proximal movement at the very end of that. So let's do the strength test.
Okay.
So at the count of 3, 1, 2, 3, go. Don't let me break it. Don't let me break it. I can break it a little bit, okay? But you're definitely stronger. How do you feel?
Yeah, I felt like there was more movement.
So that's what they call a nursemaid's elbow. You know, the maid taking care of the child walking across the street and yanking on their arm to cross the street creates a traction injury to that.
Okay.
Any idea how you got this?
No.
Yeah.
Really, I don't.
Yeah.
There
yeah.
wasn't a specific incident.
Certainly. But with 3 children, maybe lifting and carrying and
possibly
moving things, who knows? But anyway, that's the treatment that I use for a tractioned radius. And I failed to palpate the radial head, but I bet you would have been very tender there, especially on that annular ligament.
It is there, sort of,
Yeah.
when I touch it there. For sure.
Alrighty. Well, touch it there and tell me. I don't know if you can tell if there's a difference or not.
It still hurts, like where the nerve goes through.
Uh-huh. And so I think there's still some soft tissue issues going on. You know, the insertion of the triceps and such. So there's more work to be done. But in terms of the radius, that hopefully will be a one-time treatment.
Great.
So I thank you.
Yeah,
I appreciate
thank
it.
you.